So at this ASH meeting, I discussed the management of patients with chronic lymphocytic leukemia refractory to both BTK inhibitors and BCL2 inhibitors. And in the last few years, we made huge progresses in the management of patients with chronic lymphocytic leukemia. And these two classes of drugs are actually approved and currently available for the treatment of patients with chronic lymphocytic leukemia with chemo-free approach because they are targeted agents. But in the last few years, we identified a novel unmet clinical need represented by patients who are refractory to both classes of agents, BTK inhibitors and BCL2 inhibitors. And nowadays, in clinical practice, we have few standard treatment options to be administered in this category of patients, but there are new ones currently in advanced phase of development that should become available in the next future. One type of treatment is based on the administration of non-covalent BTK inhibitors. They belong to the same class of covalent BTK inhibitors that are the ones currently available, but they prove to be effective also in patients who became refractory to covalent BTK inhibitors. And these are all oral drugs administered as continuous treatment. The two in most advanced phase of development are called pirtobrutinib and netabrutinib. And the other strategy I discussed during the meeting is the use of CAR T cells. So CAR T cells are a very promising potential strategies in double refractory patients. They should be improved because in CLL there is an effect of leukemic cells on T cell function, and T cell function is impaired. So we need to optimize the procedure for CAR T cell administration, but there are some preliminary results showing a potential long-term efficacy and deep responses in patients with chronic lymphocytic leukemia receiving CAR T cell therapy.